presentation?
Not yet.
No.
Okay, let's start to share here. Can you see now?
Yes.
Now you can see?
Yeah, we can see that.
You can also see the Pujari there. Very good.
Let me close here. Too many people talking, you know, Latinos and Brazilians, they talk too much. Meningiomas. This is my disclosure. I train with Dr. Omefti. Time we learn something, we forget something, we change something, but the philosophy is the same. That time, Professor Yashar Gil was there, and now in 22, in honor of him, the Yashar Gil Micro Neurosurgical Academy. Harvey Cushing said so many years ago, 100 years ago maybe, there is nothing more gratifying than a radical removal of a meningioma with neurological preservation. It's our goal. I think when you are in the medical school, when you go to the neurosurgery department, the more amazing surgery is the removal of meningioma and clipping aneurysm. Clipping aneurysm today is controversy. But the meningioma, they start to have a controversy, but the time is playing to us. There is nothing more gratifying to have like this guy, 47 years old, with tetraplegia, wheelchair, who do the surgery, you remove the tumor, is more up clivus, lower clivus, and the guy come back to home. Meningioma is very confused. Everybody has a case like that. 75 years old female, severe comorbidities, 10 years follow-up, trigeminal neuralgia, controlled by medication. And the patient is okay. And nothing happened in 10 years. Now she's a lady 77, she's living very well, taking the medication, and this tumor is quiet. Meningioma sometimes is different. But at the same time, can have a behavior that is completely different. You cannot lose the time. 2017, 45 years old female came to our department with diplopia. After pass for many doctors say, oh, don't do surgery. You have problem with tetraplegic. You go to the state tracheostomy forever. The lady disappeared. 2018, 19, now she came back with ataxia and has some edema in the brainstem. And came the pandemic time, 2020, see the edema, the PO invasion to the brainstem. Now this surgery is very difficult. Now if you try to do the radical removal of this tumor, you have severe morbidity. Different than here, to have a very nice plan. We lost the time. We said something to the patient that should not be said. This is very important when we talk about that. Now there is a new player, the radiation therapy. On the 80s, they show that it's possible to control the growth. But how long? We don't know. As I showed today in the morning, the cavernous sinus meningioma is one example. You see this here, gamma knife works. This meningioma, there is some change. A meningioma, nothing happened. Oh, control. This guy also is under control. Do you know this guy? The Hannibal. He's under control. They put him in the jail. He's in control. But to make me more worry and sad, if you go to the biggest meeting in the whole world, the WFNS, the American meeting, okay? Lexel gamma knife. This is the propaganda to treat a meningioma with radiation therapy. Ladies and gentlemen, this tumor you can remove in any part of the world. Just understand the anatomy and go there, supracerebellar, and take the tumor out to be like a ball. In the attachment, very small attachment here to the tentorium, game over. No radiation therapy, no machine, short instrument, cheap instrument, and done. This is the pre and post-op. Some people say, oh, the tumor that you give radiation that continue growing or change because the tumor was a bad guy. This Dr. O'Mafty published many, many years ago. To know of the percentage of meningioma that is really grade 1, it's really bad, 2%. What we are seeing today that is the guy that transformed with our adjuvant therapy, like this man here. Surgery, by surgery, remove, leave a little bit. It's okay. Preserve the function, patient's okay. Give you gamma knife or radiation therapy. Decrease a little bit or no change. 5, 6, 7, 9 years, the tumor is back. Now it's crazy. It's completely different, the behavior after the radiation therapy. A paper is coming out now from cancer and from neurology, neurosurgery, psychiatry, because the big journal didn't accept radiation effect. I don't know why. Showing that is what we are seeing every day. A patient was sent to me, very nice surgery, keyhole retrosigmoid approach. Everybody was happy here. The patient was happy because improved the facial pain. The surgeon was happy because no complication, any kind of disease. Also, the tumor was happy because the tumor was alive. And they decided to give radiation therapy. 2014, 2016, 2018, looks like stable, control. 2020, the tumor is back. Now, very aggressive. Facial anesthesia, you call anesthesia dolorosa, the worst complication you can get. I did surgery, was sent to me, I removed maximum that I could, clean the MRI. 1 year later, the tumor was back. The guy that was a nice guy, grade 1 meningioma, we transform him in a bad guy, giving radiation therapy. And now, the same patient, the very nice lady, radiation-induced cognitive disturbance. Now she has tumor and dementia. We know that radiation is not good. Radiation-induced meningioma is the only external factor that is proved that produce brain tumor or intracranial tumor is the radiation-induced meningioma. We do many, many, many years, as Professor Umansky showed here. Very low doses to treat tinea captis in radiation-induced every day. Like this case, leukemia, they used to do prophylactic radiation therapy after 10, 15, 20 years. Now, radiation-induced. In the childhood, leukemia, brain radiation, 37 years old, 19 years later. Remember, we are not treating cancer. We're treating a benign tumor. This patient will survive 20, 30, 40 years. Here, 20 years, tumor's back. Was operated by a very good neurosurgery in my country. They clean very well. 1 year later, come back. Now come to me. I clean maybe in 1 year or 2 years back. He's still grade 1, but he's a bad guy. He's the guy that say that he's good, but he has a very bad behavior. A lot of people in the world is meningioma grade 1. Looks like good guy, but when you see, you pass 1, 2, 3, 4, 5 years, you see this guy was not so good that we believe. Radiation induced with the doses 1 to 2 giga, 95, more than 2 giga, 80 times more. 18 times more. 19 years in the death sentence is to give more than 20. Remember, a lady or a guy, especially a lady with 40 years old, with meningioma, still survive 20 years. Not because of the surgery, not because of the meningioma, but we transform this benign tumor in 1 year. It's the literature. If you go to the dentist to fix your teeth, you have 2 times more incidence of frequency of skull-based tumor. See, if don't wash well, brush your teeth, maybe you need to fix something. You have some cavity, maybe you can have a meningioma in the future. And now the people from radiation oncology, if you want to read something from radiation oncologist or radiation therapy, don't read the paper from one institution. Read the paper, the multi-institution, that nobody is the author, nobody is the data. And this data say, bad molecular spectrum is not indicated now for adjuvant therapy. They say that you should never give prophylactic radiation therapy for grade 1 meningioma. In subtotal removal, we need more study to say this really, really works. Maybe no knife is the best way, no X-ray is the best way, maybe the best way just to wait. Now this paper from cavernosinus meningioma from France, 20% increase in size. 10 years follow-up, 7-1 is stable, 10% decrease. In complication, of course, one of them that they give radiation transform, radiation-induced meningioma, and they follow up longer to have more and more problem. Let's show just one case to finish here. 2017, patient came to me, I did surgery, I cleaned, I think very well. I was very happy. I was feeling the best surgeon in the world, you see, very clean. I show me everywhere. I'm the man, you see. 21 is back a little bit. 22 is back a little bit. Same size. What's happened to the patient? Asymptomatic. Now she's 60 years old. She's living her life. Any symptoms, leave her. She can live. She can live without any additional treatment. Sometimes you can do an indirectly surgery, just decompress the optic nerve, unilateral or bilateral, decompress the optic canal. You can open the both canal. Sometimes you need to do a prophylactic recurrence, tumor like this. You need to remove the tumor and also the dura. Understand, 90% of your recurrence to meningioma is less than 1 or 2 centimeters to the center. We need to remove the tumor that's in the center, but the babies that are around. Because this, you never cure a meningioma when you come from the nose, because you are looking for this, and the tumor will recur in the lateral. In 100% of the case, it's a matter of time. You need to go and clean and do that. Some tumor like this is the best choice. Very small tumor in the Parkinson triangle, totally extra duro. Understand the disease, understand the anatomy, understand where the tumor is, and you go directly to the point. Don't need very fancy, long, extend approach. Know where the money is. Go directly to the focus. If you go there and clean and remove. I know that there is a lot of young neurosurgeons here. Someone give me 30 seconds to say something. Neurosurgery, you need passion. My life, I like football. I love neurosurgery. I like to meet my friends and eat a very good meat and drink. But neurosurgery need passion, determination, need focus. Focus. Keep your focus. And nobody has a divine talent. Few players, football players in the world. Maybe it is two Brazilian player, Ronaldinho, that is Pelé. Why Messi is good? Because he has focus, determination. Why Cristiano Ronaldo is good? Consistency. Consistent. He believes in himself. He trained 24 hours. He's concentrated with what he's doing. These guys make the difference. And you can do. I'm not better than anyone. Professor Bernard Bendock showed beautiful case. He's not better than anyone. He concentrated, he focused. Now he's good. Now I can be a little bit. But focus and determination. This is neurosurgery. And nobody work alone. We need the people to help you. And you improve. Always you learn. Dr. Lomberti, I'll say to me, one rose in each garden. You go learn from one guy to another guy. Listen, go watch. You make a difference in your life. My little friends, my great friends, see you in Dubai. Dubai will be the meeting of the union. After all the things that's happened in neurosurgery, the union is coming to Arabic world, is coming to Dubai. Thank you very much. Sorry that I passed so long time, but Salman, I'd like to say to the young generation this word. Thank you and sorry for the long time.
No problem.
Yeah, but thank you for a fabulous talk.